Joining me now is former Democratic Congressman and retired Admiral Joe Sestak. Admiral, thanks so much for your time this morning.
Mara, it's good to be with you. Thank you.
Now, I want to start with asking you, you've been a supporter of Obamacare. With all of the problems with this rollout, has that changed your feelings about this legislation at all?
Not at all with the legislation, but this administration showed no accountable leadership for making it ready. Look, I learned in the Navy, expect what you inspect. And the president should have been waiting for something to come to him. He should have been down there demanding input to see that a botched implementation didn't occur. But all that said, when 60,000 Pennsylvanians were losing their health care every year before the Affordable Care Act was passed, that's the equivalent of the entire population of Harrisburg, our capital, in 44 weeks. That means that this is a major step forward. And so this website has got to be fixed. And I think the president had to keep his promise. But what he has proposed now is a little bit late. But I think you need to keep in mind, Mara, that the Affordable Care Act actually had in it that the insurance companies on their own could have grandfathered individual plans if they had wanted to. So now the president has said to them, okay, if you would, and you state insurance commissioners, if you would, please, let's grandfather those individual plans until we can get the website going. Do I think this is a great execution? Absolutely not. But do I think it's going to be more fair to Americans like those 60,000 that were losing their health care every year up here because affordability was getting so much greater and because small businesses were not providing health care anymore? Yes, this design is right. Execution's very poor.
Now, in terms of the president's response to all of these problems, by and large, he said, I didn't know. Is that an acceptable response to what is his signature legislative achievement, that I didn't know that there were all these problems? Should he have known?
It's not an acceptable response, and he should have known. It's like I just said, expect what you inspect. The captain gets off the bridge wing of a ship and goes down to the mess decks and walks around. He knows what's going on, particularly when this is so important here in America. Look, in the military, we don't give health care because we're liberal or because we're socialist. We're anything but. We give health care because we want to have productive warriors, that when bin Laden has to be gotten, SEAL Team 6 is ready to go. That's why I supported the Affordable Care Act. We lose $100 billion every year, Mara, because of the under and the uninsured. I want a productive workforce, that people are ready to go at all times to compete with China. And when you had for years 5,000 people in Pennsylvania losing their health care, then you know that we're not as productive as we have to be. And in fact, you know what, Mara? This even decreased the national debt the way we did it. We've got to get through this poor execution, and the president has to show leadership and make sure that promises are kept, because otherwise the biggest debt in the nation is not the national debt, it's the trust deficit, and that's what he has to regain.
Now, in terms of the goals of this legislation, it wasn't just that more people would be covered, but that they would have more quality coverage. So this one-year extension may fix a short-term political problem, but do you think it addresses the policy concern?
It does once the full bill is ready to go, and that can't be ready to be executed till the websites are ready to go. So I don't like that we're kicking this down the road for the individualized market, those individuals that have to buy it on their own because they're on their own in their own business or their employer doesn't provide it. But once it's fully implemented, we then make sure that everyone has basically the choice to have the same type of benefits a Congress member has. And that means that no longer can the 5 million Pennsylvanians that have pre-existing conditions, including 800,000 children, like my daughter, can never be denied health care because of pre-existing conditions. No longer, if you get cancer or diabetes, can there be a limit that after $100,000 a year, or whatever the insurance company says is your limit per year for your health care, all of a sudden they can stop providing it. And it also means for women, where so many, the majority of health care plans in the individual markets don't provide for maternity care, that's no longer denied. And one last thing. Since the Affordable Care Act has been passed, Mara, health care, which had been growing, the cost of it, 8% every year, has now been growing only 4%. More to be done. It's an imperfect bill, but we're going to have a much more healthy and therefore productive workforce because of it.
All right, Admiral Joe Sestak, thanks so much for your time this morning.
It's great to be with you. Thank you.